Girls is marking the 10th anniversary of the She Matters Equity Summit and Awards. We'll hear about the progress being made and why there's so much to celebrate. And Pittsburgh is the city of bridges, but one woman is working on building bridges between people. We'll explain how. So pull up a chair and meet us at the corner. Intersection starts right now. Hello, I'm Lisa Smith, the Director of Community Impact at KDKA Plus and the host of Intersections. Giving kids and families in Pittsburgh, along with Allegheny and Westmoreland counties, a healthy start is the mission of Healthy Start Pittsburgh. It's an organization started 34 years ago as part of a nationwide project to address increasing infant mortality rates and high cases of babies born at low birth weights, particularly among minority and low-income families. Today, the organization offers access to a number of services for mothers, babies, and families, and they have a big event coming up. It's their biennial Maternal and Child Health Gala. So here to share more details is Jada Shirriel. She is the CEO of Healthy Start Pittsburgh. Thanks so much for being with us today.
Thanks, Lisa, for having me.
All right, so 30 years Healthy Start has been around. What kind of started Healthy Start? Why was there that need for this organization?
So Healthy Start started in 1991. It was a federal demonstration grant started under the George Bush Senior administration, focused on addressing the nation's deplorable rate of infant mortality. So there were lots of reports coming out at that time around why babies were dying before their first birthdays. SIDS, we didn't know that much about SIDS back then. We've made a lot of progress and advances around understanding and preventing SIDS, but in 1991, the Healthy Start project was started federally. There were 15 demonstration pilot sites. Pittsburgh was one of those 15 pilot sites. There are now over 100 Healthy Start grantees across the country. We receive our funds from the federal government, the Department of Health and Human Services, Health Resources and Services Administration, and that grant allows us to address infant mortality as well as other broader maternal and child health issues from a community context.
Yeah. So you talked about infant mortality, but there seems to be I guess the focus is expanding to really not just the babies, but also the mothers. Tell us what you guys do to make sure the mothers have what they need.
Absolutely. So while we've still got to make sure that our babies are safe and healthy, a baby can't be safe and healthy without a safe and healthy adult and community. So maternal health has really taken precedence lately. We're seeing a lot and learning a lot more about the factors that impact women's health and how preconception health, that's what we call the health of a woman or birthing person before they decide to reproduce, if that's their decision. Things from what do we need to do prenatally to be healthy, vitamin intake, getting good, equitable prenatal care, so access to care, making sure that that care is culturally responsive, making sure that physically and geographically that there is care located in communities. We do screenings and assessments, so we consider ourselves to be an extension of healthcare. We are not a clinical healthcare provider. We're a community provider that supports moms and babies' outcomes. So the work that we do is typically in community and in home. So we want to make sure that the participants in our program have their doctor's appointments scheduled routinely and that they can get to them. So we're addressing things like maybe transportation barriers. During the pandemic, for example, folks couldn't, if you had other children and had a doctor's appointment in a hospital, you may not have been able to take those other children, and you may have missed appointments. So working with our health systems to try to figure out how to troubleshoot and address issues like that. We screen for food insecurity, intimate partner violence. When we go into the home and work with our families, we're assessing and we're saying, what else is going on in your life? How can we support you? And how can we take some stress off of you? Yeah. How can we help you navigate other resources like WIC, other things that you may need, any specialist referrals that you may need. Some folks decide they don't want to birth in the hospital, they want to birth in a birthing center like the Midwife Center, or that they need a doula, or that they hopefully would like to decide to breastfeed, and so we can start that education early. So those are all the things that we do that are focused on women's health, that support improved birth outcomes.
Yeah, and you mentioned breastfeeding, and I think you were telling me that August is Breastfeeding Awareness Month.
Yes.
And you have an event coming up related to that. Tell us about that.
We do. So to celebrate Black Breastfeeding Week, which occurs in August, we have an annual Breast Friend Brunch. That is a time for those who have experienced breastfeeding or who support breastfeeding families to come together and just celebrate and uplift the art and benefits of breastfeeding. And so that is August 23rd. It's at Cohatch on the South Side. And for more information or for tickets, you can visit our website, www.healthystartpittsburgh.org.
Yeah. The other big event you have coming up is your biennial gala.
Yes.
And it's the Healthy Start Maternal and Child Health Gala.
Yes.
Tell us about that.
So we are back. So post-COVID, we are back to holding our gala every other year. This will be our first post-pandemic gala. So the last time we had it kind of right toward the end, and we had Tatiana Lee, who everyone knows her as Ashley Banks, but she is a maternal and child health advocate. And she was wonderful hearing about her work. And so we always try to bring in someone who is going to elevate who we can elevate their work because they're doing great work, but also they can just elevate some of the broader issues around maternal and child health and health equity. So this year we have Dr. Uche Blackstock. She is a trained medical doctor who then turned her career to focus on health equity based on her own experiences. We're going to be honoring some other folks in our community who are focused on making communities healthier. We'll have dinner, we'll have an auction, drink, celebration. We have a wonderful MC, and we'll have a fireside chat with Dr. Blackstock. So that is on September 18th. We are still selling tickets. It's at the Omni William Penn Hotel downtown. It's not too late to buy a ticket to come out and support. It's not too late to have more sponsors added to our list of sponsors. So our two key sponsors right now are Highmark Whole Care and Allegheny Health Network, First Steps and Beyond. We also have a growing list of other sponsors and appreciate the support.
Yeah. And so we're almost out of time, but I do want to note that you guys also are involved in research, right?
Yes.
Why is that important for you to be part of making sure that groups here are included in studying what the needs are for mothers and babies?
Yeah, that's a great question. So when we think about how the Healthy Start initiative started, it started based on research that led us to the conclusion that we need to be doing something about the rates of infant mortality. So as we continue through, this journey 34 years later, there are a lot of social issues and medical issues that impact the health of Black women, babies, families, fathers, and our community. And so given the very dark history that we have in our Black community with research, we understand when there can be a reluctance to participate in research, a lot of distrust, but at the same time, we need to be at the forefront of the research that is going to be impacting our communities. So when we're looking at things like the higher rate of prevalence of hypertensive disorders of pregnancy among Black women, that Black women are more likely to die from preventable causes related to their childbirth, et cetera. We want to make sure when that research is conducted that there are Black women on those research teams, that there is equitable compensation and engagement of community so that it is really good community partnered research. And we also want to make sure that that information and what's learned comes back to benefit community in some way that's bigger than just a gift card and a lunch. Yeah. So that's what we do, is we try to make sure that there is a stronger understanding of why it's important for us to participate in this research, that we're mitigating harm that's being done in our communities via research, and that we are part of the research process and team from the beginning.
Well, we really appreciate you coming and sharing all of this vital information, and much success with the gala, and thanks for all you do. We appreciate you.
Thanks for having me.